This is The Broken Shift with Nurse Natalie. Healthcare doesn't break in chaos, it breaks quietly. A nurse posted a photo of an unconscious patient for social media. Not for education, not for documentation, for content. At what point did patients start becoming content? Someone please let me know, because I've been seeing a lot of this and I'm just trying to figure it out. I'm sure some of you are too. I came across a discussion online about a nurse influencer who allegedly posted a photo taken inside an ICU room. The patient was unconscious, critically ill, and while the patient's face was covered, there were still visible details, IV bags, monitors, equipment, things that in the right context could possibly and potentially be identifying. So, beyond that, the bigger issue isn't just what you can see. It's that the photo existed at all. And so that meant that it was on this influencer's phone, on a personal device, in a moment that patient could never consent to. So if you were that patient, would it matter that your face was covered? Or is the photo itself the problem? I've seen the image being discussed on Reddit, and I'm not going to show it here because the entire point of this conversation is that some moments in healthcare are not meant to be shared. I could post it here, but I already feel like it was wrong to post, so to keep reposting it would not make any sense. Do you think everything that can be posted should be? What do you think? Drop me a comment and let me know. Because when I read this, I didn't just think that's wrong. I felt it. Because this isn't just one post. This is about something shifting in healthcare. Now think about this. Have you noticed how much of healthcare is starting to show up online now? Everything. A lot of people immediately ask, is this a HIPAA violation, right? And the truth is, that's not always the most important question, believe it or not, because something can be technically allowed and still completely wrong, right? Just because you can do it doesn't mean you should do it. And this isn't just about policy, it's about dignity. Can you imagine you're a patient, you're that patient in that room? Does your dignity matter? Is it about trust? It's about understanding that some moments in healthcare are not meant to be captured at all. And not at your discretion, not as the healthcare provider. Because the real issue isn't just a photo that was taken. It's that a patient in one of the most vulnerable moments of their life was seen as content. When did that happen? Where do you think the line is between sharing your job, right, and exploiting it? I don't feel like this is just exploiting your job. It's exploiting the people that you're taking care of. And part of what makes this so uncomfortable is that it didn't come out of nowhere, right? Something has been shifting in healthcare for a while now. And we're going to talk about that. There was a moment that really highlighted this shift. In a reported case out of Canada, a healthcare manager responded to nurses who were frustrated about limits on overtime. This happened a couple years ago. Instead of addressing staffing or workload, a leaked internal message suggested they look into other ways to make money, including things like investment banking, fund management, and even becoming a TikTok influencer. Yes, that was in the leaked email. How do you think that lands with nurses already burned out at the bedside? I would imagine not too well, right? Because when I read that, it didn't feel like support. It felt like disconnect. Like the reality of nursing wasn't being taken seriously. Do you think healthcare workers are being pushed to turn themselves into content just to keep up? I mean, that's basically what this manager said, was turn yourself into content. And this is where the line starts to move. First, it's harmless content, right? Days in the life videos, shift recaps. Then it becomes filming at work, showing what a shift looks like, right? We've seen those where people have actually made med errors while they were doing this. And eventually, for some people, the patient becomes part of the background. And this is where it becomes bigger than one post, because healthcare runs on trust. Patients trust that their worst moments, their most vulnerable states, their bodies, are not going to be used for someone else's audience. If patients start to lose trust in nurses, what happens to healthcare? What happens to healthcare? Most nurses would never do this, I know. But it only takes a few moments like this to change how people see the entire profession. This influencer allegedly has 300,000 subscribers. How many people saw that post before she took it down? And somewhere along the way, a line got blurred between sharing your experience and using someone else's, between building a brand and crossing a boundary. The moment a patient becomes content, we've already lost something in healthcare. Do you think social media is helping healthcare or slowly damaging it? I want to hear your thoughts on this one. This is The Broken Shift. My name is Natalie. Hit that like button, subscribe, and hit that notification bell, and I will see you in the next one. Healthcare culture doesn't change when we ignore it. It changes when we're willing to examine it. This is The Broken Shift.